Hi, my name is Brittany. I'm a certified occupational therapy assistant at Spring Hill Senior Residence. As an occupational therapy assistant, my typical day consists of therapeutic activities, therapeutic exercises, patient care. Typically, we just take care of the patients and work towards getting them as independently as possible so that they can go home and perform in their environment safely. A certified occupational therapy assistant, which is typically referred to as a COTA, can work in a variety of settings, including the school system, outpatient, hospitals, or, for example, where I work, the nursing facility. I can do a variety of things, including maybe one day I have a patient who's had a stroke and they need different types of care to address a side that may have lost its function. So we may work on getting in and out of bed or getting into a wheelchair, those type things. I may also have a patient who's had a knee replacement who typically functions very well but just has some weakness. So we're going to work on being able to walk back and forth to the bathroom or getting in and out of the tub. I may also have a brain injury who has difficulty remembering certain things, so we work on recalling information and reminiscing activities. The good thing about working in a nursing facility is the fact that it doesn't close. So you can somewhat make your own schedule. Typically, my hours are 8 to 4:30 because I like to get up, get in, and get out. The stress level of this job, honestly, is very minimal. It takes a lot of interpersonal skills to handle it, and with anything, it peaks, it has its ups and its downs. Sometimes you may have a demented patient who's somewhat difficult to deal with, so your stress level may increase. However, for the most part, it's very minimal. If you're interested in going into this profession, you'll need to go to typically a community or junior college because it's a 2-year program, and you'll get a degree, an Associates of Applied Science degree, but your major will be occupational therapy assistance. Your curriculum will entail occupational therapy classes in addition to core classes, but for the majority you'll focus on occupational therapy base, which is just the foundation of OT, giving you an overview, and that'll last the first year, in addition to clinicals, which is what will give you your experience and hands-on training. Also, in addition to getting into the course, you'll have to have observation hours, which will be you going into the community to different clinics or hospitals and getting observation hours of how things go before you get into the program, so that you somewhat can get an idea if that's what you really want to do. At the conclusion of the 2-year program, you'll have to take a national board certification exam, which is a very intense test, which will test your knowledge of what you've learned over the 2 years. Lastly, you'll have to get licensed in that whatever particular state that you intend to practice in. It's also very important to have interpersonal skills and just people skills, because that's what you're going to work with. People of different populations and different genres, so you have to be able to interact with them on a daily basis. Also, it's very important to just have a genuine care for people, because that's what you're going to do. You're going to be helping someone get back to where they were. The best part about this job is that it's extremely rewarding. You get to see people go from a somewhat fragile state to going back to what they're used to, which is being at home, living, and not needing our help. But also, some of the worst things or some of the harder things to deal with is sometimes you may not see results just because some conditions are, unrepairable. And you just have to be ready to go in all hands on, because this is a touchy job. This is a manual job. You'll have to help patients get up. We focus on self-care, so you'll have to sometimes give baths and help with toileting. So you just kind of have to be ready to go in. And if you're not big on touching people, you might just want to consider that. Another difficult part of this job at times is working with patients who are not receptive of our help. They may be set in their ways, used to doing things their way, or the diagnosis, they're having difficulty recovering. So sometimes you just kind of have to give it your best shot and find a way to talk to them and work with them in a way to where they understand that you're just trying to benefit them and help them as much as possible. Lastly, if you're considering this profession, I just want to say, go for it. If you go out and you go into the community and you go to these different places and hospitals and clinics and you feel like this is what you want to do, just be ready. Just give it all you got. Just work hard and understand that this is a profession where you're caring for others. Your main job is to love and care for other people. So just make sure that you understand that before you go into it, and that you study hard, you give it all you got, and hope for the best. Another thing to think about is that you're going into a healthcare profession, and that generally you're just going to be helping others. So you should go to, like I said, hospitals, clinics, and just volunteer and see what it's like to be side by side with someone else working in their environment. And just knowing, like I said, in general, that you're going to help other people. Go hard for your biology, your science classes, your anatomy, just learn the body, and just know this is about a person. This is not a cubicle job. This is not paper. This is people. Think of it as you're caring for somebody in your family. And if you would want them to have the best care, that you would provide the same for them, for your patients.